Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
You know that moment where you're at the doctor's office? That cool stethoscope on your chest and they're listening really intently?
Classic image.
Totally. It's been around forever, such a basic, vital tool. But imagine if that same stethoscope suddenly got this secret superpower.
A superpower. Go on.
Yeah, imagine it could spot not just one, but 3 major heart conditions. And get this, in just 15 seconds.
Yeah, okay. 15 seconds. That's fast.
Right. So welcome to the deep dive. This is where we take a whole stack of information and really get down to the knowledge that matters. Today, we are diving into this fascinating upgrade for, a centuries-old medical device.
The familiar friend gets an AI boost.
Exactly. We're uncovering how artificial intelligence is basically transforming early heart disease detection. You'll walk away understanding not just what this tech does, but why it really could be a game changer for your health, potentially.
And for the whole healthcare system, I'd argue.
Definitely. So for this deep dive, we're using insights from a recent health news piece just out last month, and we're leaning heavily on the actual scientific paper, too.
The primary source, yeah.
It's called Triple Cardiovascular Disease Detection with an Artificial Intelligence-Enabled Stethoscope, Tricorder, published in BMJ Open. It details this big real-world trial.
Yeah, the Tricorder study, it's definitely making waves.
Okay, so let's unpack this. What's really going on here?
Well, it's pretty amazing, isn't it, how something so familiar, so ubiquitous, can be completely reimagined. The stethoscope, it's been essential for over 200 years, just listening, right?
Right. Simple but effective.
But this new AI version, it looks kind of similar, but inside. It's packed with advanced sensor tech. You've got these tiny electrodes built in.
For an ECG, like the heart trace.
Exactly, for an electrocardiogram.
Yeah.
And also a really sensitive microphone, much more so than traditional ones, to record the heart sounds. Phonocardiogram, essentially.
So it's not just listening anymore. It's actively collecting diagnostic data, proper data.
Precisely. And the process itself, it's designed to be quick and simple in, say, a GP's office.
Okay, so how does that actually work? A patient comes in.
Right. The doctor or nurse places the device on the chest, just like usual. But they only need a single recording, 15 seconds. That's it.
15 seconds. And then what? Does the stethoscope itself tell you anything?
Not directly, no.
Yeah.
That data, the ECG and the sounds, it's securely zipped off to the cloud, to these powerful AI algorithms.
Ah, the AI part.
Yeah. And these algorithms, they've been trained on massive amounts of health data, tens of thousands of people. So they can spot these really subtle patterns, things a human ear, even a trained one, would likely miss.
Patterns indicating heart problems.
Exactly.
Yeah.
Subtle signs of heart failure or valve disease or that tricky atrial fibrillation rhythm. The analysis is super fast, so the result gets sent right back to the clinician's smartphone, usually within moments.
So it's augmenting the doctor's senses, basically, hearing the unhearable.
That's a great way to put it. It analyzes tiny, almost microscopic differences in the heartbeat, the blood flow sounds.
Yeah.
Things just undetectable normally. It really boosts what a clinician can do right there at the point of care.
Okay, that sounds impressive. In theory, a superpower and a stethoscope, but, the real test is always the clinic, isn't it?
Right.
Not just the lab.
Absolutely.
So the Tricorder study you mentioned, its goal was to prove this wasn't just like a cool gadget, but something that actually makes a difference in everyday practice.
That was precisely the mission, to see the real-world impact. The objective was to run a pragmatic trial, meaning they tried to make it as close to normal clinical practice as possible.
Not some artificial lab setup.
Right. They wanted to find out, if we give primary care teams these AI stethoscopes, does it actually help them diagnose 3 specific things earlier? Heart failure, atrial fibrillation, and heart valve disease. The focus was squarely on early diagnosis, shifting detection much earlier in the disease process.
Okay, pragmatic, real-world trial sounds like a pretty big deal, not just a couple of clinics. What did that actually involve? Where did they do it?
Oh, it was substantial. Really designed for broad applicability. It was what researchers call a 2-arm, multi-center, cluster randomized controlled trial.
Whoa. Okay, break that down a bit. Sounds complex.
It just means they tested it rigorously across many different places. They randomly assigned whole GP practices, the clusters, to either get the AI stethoscope or just carry on with standard care. That way you can compare fairly.
Makes sense. Comparing like with like, but across whole practices.
Exactly. And the scale was impressive. over 200 GP surgeries involved, across very different areas, urban northwest London, but also rural North Wales.
So different types of patients, different settings.
Definitely. Covering a massive patient population in total, over 1.5 million people registered at those practices. And within that, about 12,725 patients were actually examined using the AI stethoscope in the group that had it.
And they compared their outcomes to the group that didn't have the tech.
That's right, the control group. They focused the study specifically on patients who came in with certain symptoms too.
Okay. Not just screening everyone.
No, exactly. It was for people presenting with common things, stuff that could be heart-related, but is often vague, like, feeling breathless, really tired for no reason, maybe some swelling in the legs or feet.
Symptoms that could be lots of things, I guess.
Precisely. Symptoms that often bring people to the GP, but pinning down a heart cause early on can be tricky. The clinicians who had the AI stethoscope got training and then used it when they thought it was appropriate, guided by some new guidelines for the trial.
So they used their clinical judgment on when to use it on these symptomatic patients.
Yes, which helps see how it would actually fit into practice, not just forcing its use, makes the results more, real-world relevant.
Okay, so they set the stage, rolled out the tech, big trial, real-world conditions. The suspense must have been building. What did they actually find? Did these AI stethoscopes move the needle on early detection?
They really did. The findings were pretty dramatic, actually. Big increases in early detection across the board.
Okay, like how dramatic? Give us the numbers.
Right, for heart failure. Patients examined with the AI stethoscope were about 2.33 times more likely to get diagnosed within the next year compared to similar patients in the standard care group.
Wow, more than double the chance of catching heart failure early. That's huge.
It is. And remember, atrial fibrillation, that irregular heartbeat, often silent, big stroke risk.
Yeah, the one that often causes strokes without warning.
For that, the impact was even bigger. Patients were 3.45 times more likely to be diagnosed.
3.5 times? That's incredible, especially for something often symptomless.
Exactly. Catching that early means you can start treatments, like blood thinners, potentially preventing a stroke down the line. It's a massive win.
And the third one, heart valve disease.
Also a significant jump. Patients were almost twice as likely, 1.92 times, specifically to get a diagnosis of heart valve disease within that 12-month window.
So across all three conditions, substantial improvements in early diagnosis.
Yes. As Professor Nicholas Peters, one of the senior investigators, put it, the study basically shows you can now potentially identify 3 key heart conditions efficiently in one go, right there in the GP's office.
Those numbers are really compelling, but let's translate that. Beyond the stats, what does this actually mean for you, the patient? Why is catching these things early so incredibly important?
That's the crux of it, isn't it? Early diagnosis is just vital. It means patients get identified when treatments can make the biggest difference, before they get really sick, before they end up in hospital as an emergency.
So catching it when symptoms might just be starting, maybe feeling a bit off?
Exactly. Someone feeling maybe just a bit more tired or breathless than usual. They might ignore that for ages. This tech helps pick up those early, often subtle signs, prompting action sooner.
It bridges that gap between feeling a bit unwell and a full-blown crisis.
Precisely. Dr. Sonia Narayan from the British Heart Foundation really emphasized this. She said, we need innovations like this because right now, heart failure is often diagnosed way too late, usually when someone's rushed to hospital.
That sounds reactive, not proactive.
It is. But she points out an earlier diagnosis means people can get the treatment they need to, quote, live well for longer. It's about quality of life, not just survival. Avoiding those emergency admissions, those really difficult periods. Imagine skipping a major hospital stay because a 15-second test caught something early.
That's a powerful thought. So what's the current situation it's trying to fix? You said diagnosis is often late.
Yeah, the current reality is pretty stark. For heart failure, over 70% of diagnoses happen at an advanced stage, often in the ER.
70%? That's incredibly high.
It is. And the kicker is, studies show more than half of those people actually had symptoms or saw their GP earlier on. But the connection wasn't made. It represents this huge missed opportunity.
An opportunity this AI stethoscope could seize.
That's the idea. It offers a chance to intervene much earlier, to shift diagnosis out of the emergency room and into the community, into your local GP's clinic.
And I guess that has knock-on effects for the healthcare system, too. Less burden on hospitals.
Absolutely. Dr. Mihir Kelshiker, another researcher on the trial, said this could really change things, giving GPs a quick, simple tool to spot problems earlier, getting patients treated sooner. And that saves money, too.
Ah, the economic argument.
Yeah, there are reports suggesting it could save around £2,500 for every heart failure patient diagnosed in the community versus through an emergency admission. Better care, less cost. It's potentially a win-win.
Okay, so the potential seems huge. Better patient outcomes, cost savings. It sounds almost too good to be true. But, rolling out new tech in healthcare is never simple. Were there challenges, nuances, limitations found in the trial?
That's a very important question. And yes, there were significant real-world hurdles. Despite the impressive detection rates, there was this quite startling finding about adoption.
Oh, what was that?
Well, 70% of the GP practices that were given these smart stethoscopes either stopped using them or use them very infrequently after the first year.
70%? Wow. That almost seems to undermine the positive results, doesn't it? What's going on there?
It's a critical finding, and it tells us a lot about implementation. It shows that just having a great tool isn't enough. You need to properly integrate it into busy clinical workflows. Doctors are under immense pressure.
Time pressure, administrative burden.
Exactly.
Yeah.
So adding a new step, even a quick one, needs careful thought. The researchers suggested that real effort is needed to embed this tech into routine practice. It's not just about the tech, it's about the system around it. Maybe needing dedicated training, better IT integration, maybe even specific staff roles.
So the human and system factors are just as important as the AI itself.
Absolutely crucial. It highlights that hurdle for any new health tech, really.
Okay, that's a major caveat on the implementation side. What about the technology itself? Any concerns there, like false positives, getting a worrying result when nothing's wrong?
Yes, that was looked at too, and it's another important nuance. The study did find that about 2/3 of the people flagged by the AI as having suspected heart failure, well, they turned out not to have it after further tests, like blood tests or proper heart scans.
2/3 is quite a lot. That could cause a fair bit of anxiety, couldn't it? And lead to more tests.
It certainly could, and that's a valid concern. Unnecessary anxiety and follow-up tests are things to avoid, but the researchers really stress the context here. Meaning this tool is intended for patients already showing symptoms suggestive of heart problems. It's not meant for screening healthy people off the street.
Ah, so it's a tool to help investigate symptoms you already have, not for general checkups.
Precisely. Its value is in picking up potential signs in those symptomatic patients that might otherwise be missed, prompting the right further investigations. It's about guiding the diagnostic process more effectively in the right group of people.
Okay, that clarifies the intended use. And you mentioned the study design was pragmatic, real world. Did that have any downsides in terms of the data quality?
Well, the upside is it's very generalizable. It reflects reality. The potential downside, as the researchers acknowledged, is that relying on routine medical coding, the standard notes doctors make, might lack some of the super fine detail, the granularity and fidelity, they called it, that you'd get in a tightly controlled, purely research-focused study.
So maybe missing some tiny nuances, but capturing the bigger picture accurately.
Kind of, yeah. But despite that, senior figures involved, like Professor Peters, emphasized the tech is already out there, being used in some GP practices now. And Professor Mike Lewis from the NIHR called it a potential real game changer for patients. So the overall confidence seems high.
Right. And one last thing on the study design, AI and bias is always a hot topic, especially in health. Do they account for that?
They did, very intentionally. That wide geographical spread, urban London, rural Wales, and covering diverse patient groups, different ethnicities, socioeconomic backgrounds, that was specifically done to try and proactively address those well-established concerns around AI bias.
Trying to make sure it works fairly for everyone.
Exactly. Building trust and ensuring equitable benefit is essential if this is going to be rolled out widely.
Okay, so stepping back, what's the big picture here? This AI stethoscope. It's not just a gimmick, is it?
Not at all. It seems to be a genuinely powerful tool. It's breathing new life into one of the most fundamental medical instruments we have.
Taking something old and making it radically new.
Right. Offering this very real potential for much earlier, potentially life-saving diagnoses for millions. It really seems to bridge that gap between traditional hands-on care and cutting-edge AI. empowering doctors, basically.
Giving them that extra sense quickly and easily right there in the clinic, it really does feel like bringing the future of medicine into the standard checkup. So the benefits seem clear. Catching heart failure, AFib, valve disease earlier is huge for patients, potentially great for the healthcare system too. But as we discussed, those challenges remain. Getting it actually used consistently in practice.
The 70% hurdle.
Yeah. And balancing that early detection benefit with minimizing the anxiety and extra tests from false positives, it's a tricky balance.
It always is with new diagnostic tech.
It really makes you think, doesn't it?
Yeah.
How many other conditions might be slipping through the net diagnosed too late just because we lack these kinds of rapid, smart tools at that first point of contact?
It's a profound question about the potential of technology in primary care.
And it raises the question of responsibility. What role do we as individuals and the healthcare systems play in making sure these kinds of advancements actually reach the people who need them? How do we translate promising trials into real community health improvements, something to perhaps think about next time you're at the doctor's, maybe hearing that familiar stethoscope sound?
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.